So today let's talk about urinary tract infections in young children, could be infants or young children. So urinary tract infection is not only in adults, and most time we tell baby mothers that your children have urinary tract infection. They doubt because they feel that it's only through sexual intercourse people get urinary tract infection, but your child does not have to get involved into sexual intercourse before getting infection. So there are other causes that will make a child to have urinary tract infections. So we're going to discuss that. Let's go there quickly. Before then, let's discuss the whole urinary system here. All right. So we have the two kidneys here. For the kidney, we have here the ureter connecting down to the bladder, and then down to the urethra where the urine comes out through the urinary pathway in the female or the male. So now how does infection happen? There are causes of infections in children. So let's start with the female. Number one cause is for the fact that she's a female. She's exposed to having infection. She's exposed to urinary tract infection. Because one reason is that her urinary pathway outside, which is called the urethra, or urethra is short, and in men urethra is longer. So it's easier for bacteria to travel from here into the bladder. So that's one thing. For male, it's only under a condition when a child is on circumcised. So you find out that when the child is not circumcised, the foreskin called the prepuce can keep bacteria, and that bacteria can travel through the urethra and to the urinary bladder and cause infection. Another cause is that the kind of the wiping procedure after stool. So your baby go in toilet and then you're about to clean the baby. While cleaning the baby, you start cleaning from the back to the front. So let's take for instance now, you have the baby buttocks like this, right? And this is the front part of the baby and this is the back part of the baby. So you, instead of cleaning from the front to come back to the anus, the buttock, come to the back and clean. So people clean from here back. So the time the baby on the tank, clean from honor, bring it on tank. There's a bacteria called E. coli bacteria. This bacteria lives within the gastrointestinal tract naturally. So the bacteria can also be found in the stool. So if you clean from the back to the front, you can mistakenly take the bacteria and bring it to the child private, and then it can travel through the urinary system and cause infection. Another one is constipation. So constipation can cause stool or toilet to prevent the full emptying of the urinary bladder. So when the stool sit down in the large intestine and it rests on the bladder to be emptied fully, it will not happen. So what happens is that the bladder urine that is staying within the bladder can harbor bacteria, can allow bacteria to set in and then cause infection in the bladder. Another cause can be the use of anything that will irritate the private part, most especially the female genital part. So such as we say bubble bath. Some people can take the soap water, they set the child inside it, say they bathing the child, they try what you call. So the chemical from those things can irritate the private and cause irritation and maybe wound that will expose the child to infections. That's one thing. The other cause is the child can be born with abnormalities in the sense that sometimes the ureter have certain portion of it that is very narrow that urine cannot pass through. So sometimes it's formed like this. So if instead of it being straight, if the ureter is like this and the urine travels from the kidney directly like this, some of the urine will set in here. So the day the child is exposed to infection for the first time, the bacteria travel, some of them will set in here. If you treat, some will still survive and live here. So that's why children who have infection from the urinary system before and is treated, they can have recurring infection. So let's get it clear that children can have urinary tract infection without getting involved in contact with somebody. Then another cause is keeping diapers that is already wet by urine, or they keeping it on the baby. That urine can reinfect the child and it will cause irritation. That's the reason why most times, even apart from urinary tract infection, you see your child's skin red to the private area get red. So the urine contains chemicals in it. It has a base called ammonium. The ammonium, the child skin gets irritated with that thing. So it will cause the sore and thing will start saying it's trash, it's trash, it's trash. So we advise baby mothers once the child is crying, check the pimples or diapers. If it's wet, change it, clean the child, wet the child well before putting another one on the child. Most people don't do that. They just take it off and then put another one. The urine stain is still on the child. So let's be careful. Now, what are the symptoms of urinary tract infection in babies? They will never tell you. So they will always cry. One of the symptoms involve painful urination. So someone that will be urinating and feel pain. Children under 5 years most commonly. So you will experience that. The next one is frequent urination. They always urinate frequently, especially at night, bed wetting. So most times that's why you see children can pee to bed too much, even though we know that yes, the brain is not mature yet to send communication to the bladder to awaken them for urination. But aside that, urinary tract infection can cause frequent urination in them. So they can experience symptoms of fever as well. They can also experience condition when the kidney is involved. When the kidney is involved, when the urinary tract infection is involved, if it involves the kidney, what happens? They have symptoms of nausea and vomiting, and they also experience abdominal pain, severe abdominal pain, and fever. So, symptoms that will happen without you noticing. Sometimes you have experienced children having unexplained cause of crying, endless crying. You treat for malaria, still they still cry. You check for the diaper whether it's wet or not, they still crying endlessly. Most times they're having abdominal pain from urinary tract infection, especially kidney. So you see prolonged vomiting, they keep vomiting, fever, and what have you. So children suffer urinary tract infection, no doubt. So one of the solutions is make sure that the child is properly maintained hygienically. Change the child diaper often and monitor the child to see that they are not constipated. Every 8 hours you should be able to see that at least the child have a sign of passing stool, most especially infants and neonates. Try and check after 8 hours. If they don't pass stool, then you should be concerned. So painful urination that will make them to cry, let's take note of that. Make sure that they are clean, well handled with care, because it's just the poor hygiene with babies that lead them to all the infections and things. So thank you so much. Let's do more on this. Keep following us for more health education. Thank you.